Hey anatomists, we're looking at the femur here, and we're going to go over the structures of it. If we were to look up at this top portion of the femur, I'm going to place the bone down. We have this big old bump right here. This big old bump is going to be the head of the femur. And the head of the femur is going to articulate with the acetabulum of our innominate bone. So that's going to make up our hip joint. And it's known as the acetabular-femoral joint. Then you have the neck right here. This other bump that you notice on the lateral side, because the head is medial, is going in towards the midline of our body. This right here is the greater trochanter. Greater trochanter. And see this little bump over here? That's the lesser trochanter. There's this faint line that kind of goes in between the trochanters, and that's the intertrochanteric line. Intertrochanteric line. And that's kind of like connecting the two. If we were to flip this over and go to the posterior view of the femur, here we have the head of the femur. That is medial. So now we're looking at the booty side, the back side. Here's the head. Here's the neck. Here's the lesser trochanter, greater trochanter. And then the intertrochanteric crest. The intertrochanteric crest is basically this ridge in between the two trochanters. Coming off of the greater trochanter is this rough, bumpy part. This is the gluteal tuberosity, and that's basically what your glutes attach to. And then there's this line from the lesser trochanter, and that's the pectineal line. We have a muscle called the pectineus. So this is the pectineal line. Before I get too distal on this bone, let's look right here at the head. There's this divot that you find right there. That's the fovea capitis. Fovea capitis. Okay, let's continue on the posterior side. So we were just looking at the pectineal line and the gluteal tuberosity, and they come together. Well, essentially, this is just a rough patch right here, the gluteal tuberosity, but it looks like they come together for this line right here. This is the linea aspera. And the linea aspera is going to continue on distally, and then see how it kind of verges off right there? Well, it does it the same on the other side. And if we're looking at the femur, we see that the head is right there, and that's the medial side. So that means that this is going to be the medial condyle and lateral condyle. Medial condyle, lateral condyle. We have the medial epicondyle. The medial epicondyle, and then we have the adductor tubercle. We have adductor muscles, meaning that they're going to bring the thigh back to midline. And then from there, we have the supracondylar ridge, the medial supracondylar ridge. Lateral supracondylar ridge, lateral epicondyle, lateral condyle. In between the two condyles is this fossa. That's the intercondylar fossa. And then back here, we have the popliteal surface. Popliteal surface. And we have a muscle that is the popliteus that kind of is housed over there. Here is the anterior side. Notice that the head is right here, so that is going to be the medial side. So we know we're going to trace it down. This is the medial condyle, the medial epicondyle, and then you get the adductor tubercle right on over in here. Okay, so adductor tubercle, medial epicondyle, medial condyle. That means that this is the lateral condyle, lateral epicondyle, and then you would have your supracondylar ridge right back in here, as well as right in here. This has the patella attached to it, and you can find it right here. That is the patella. This is the apex of the patella, and it's pointing down towards your foot, and then the base of the patella. But if we were to look underneath it, that would be the patellar surface. The patellar surface.